Similarly, if the male organ has been unused for months or years without successful intercourse, its size may decrease and it may shrink. One of the reasons that may lead the patient to be dissatisfied after the penile implant surgery is the delay in performing the operation. The longer the patient waits for the operation, the worse their condition becomes, and the more the tissues of the male organ deteriorate. Consequently, the size of the male organ may shrink further. This is a significant issue that we need to clarify to the patient. The male organ is subject to a medical principle called less use atrophy, or atrophy due to lack of use. If the organ is not used sufficiently, it may shrink over time. This doesn't necessarily require many years. It could happen in months, a year or two. For example, if someone's hand is in a cast for 3 months, when the cast is removed, they might discover that their right hand is smaller than their left. This is because the muscles haven't been used for 3 months, resulting in atrophy. They would need physical therapy to restore their hand to its original size. Similarly, if the male organ goes unused for months or years without successful intercourse, it may shrink and contract in size, both in length and girth. The patient may complain after the surgery that the organ has become smaller, blaming it on the implant. However, the implant itself doesn't shrink the organ. As doctors, we implant the largest size that the male organ can accommodate during the surgery. The decrease in size is a result of neglecting your condition for a year, 2, 3, 5, or even 10 years without addressing the erectile dysfunction until atrophy occurs in the organ and it shrinks. I often have patients who say, "My organ used to be 17 centimeter. How did it become 11 centimeter?" This is not due to the surgery. It's because of the prolonged period of erectile dysfunction. For example, a patient might have been widowed for 5 or 10 years and not concerned about or focused on their erectile dysfunction. Suddenly, they decide they want to remarry. He discovers that the size of the organ has become very small, a patient with Peyronie's disease, leaving the organ constantly contracting and shrinking due to severe fibrosis. Another patient with diabetes for years, experiencing diabetic-related shrinkage and contraction of the organ. So, the longer you delay the operation, the lower your satisfaction level will be after the surgery, and the surgery itself becomes more difficult and takes longer. Why? Because the tissues have lost their vitality. When we open up, we find that the tissues are fibrotic and blood circulation is not optimal. Unlike other patients who, as soon as they started experiencing an issue and found that treatment wasn't bringing results, made the decision to undergo the operation. Therefore, one of the reasons you might be dissatisfied after the penile implant surgery is that you delayed taking the decision to undergo surgery.